Hello future nurses, hope you're all doing well. This is Manjot from Pro RN coaching classes. Together we can conquer this. We are back with another topic. In our last video we have talked about cardiac circulation और आज की वीडियो में हम बात करेंगे coronary artery disease की. तो जब हम बात करते हैं हार्ट को ब्लड सप्लाई करने की, लास्ट वीडियो में हमने बात की थी how heart supplies blood to the body. Who supplies blood to the heart? So that is coronary arteries. You can see in this picture we have two right and left coronary arteries, and these arteries divide into smaller ones and cover the heart around, provide the blood circulation to myocardium and all the other parts of the heart. तो उससे क्या होता है? Now the topic we are going to talk about is coronary artery disease. Now, what is coronary artery disease? Coronary artery disease is when one of the arteries supplying blood to heart get blocked completely or partially with plaque formation. Okay, अभी आपको मैं एक एग्जाम्पल देती हूँ. जैसे कि आप पिक्चर में देखते हो, if there is a 2-lane road और एक लेन जो है ब्लॉक है, all the cars will move to the other lane. तो उसमें क्या हो जाएगा? There will be a lot of traffic, पर फिर भी ट्रैफिक जाती रहेगी. But now what happens when that plaque forms a clot and then there's a complete blockage of the blood circulation? For just imagine कि एक पत्थर आ गया उस एक लेन में भी जो बची हुई थी और वहां पे ट्रैफिक completely जाम हो जाएगा. So now when that clot formation blocks the blood circulation completely, that's when you become symptomatic. That's when it is very dangerous. Now, while we are talking about coronary artery disease, I want to tell you about something very interesting. This is called collateral circulation. You might not have heard about this. Collateral circulation क्या होता है? We have in our body, हमारी body में छोटी veins होती हैं. There are smaller veins which connect to the main veins. These veins are not used until they need to be used. Collateral circulation is a kind of coping mechanism of the body. जैसे कि हम coronary artery disease की बात करें, when there is blockage and the body will sense that there is difficulty, that the blood is having hard time passing through the artery, तो body क्या करेगी? Body will help these small arteries grow. So these arteries may help with the blood circulation. इसको collateral circulation बोलते हैं. Collateral circulation में ये जो छोटी veins और arteries होती हैं, जो main veins और arteries के साथ body के किसी भी part में हो सकता है, connected होती हैं और when needed body इनको एक message देती है और ये grow करती हैं और ये circulation में help करती हैं ताकि complete blockage ना हो. Let's talk about the signs and symptoms of coronary artery disease. Some cases may be asymptomatic because the plaque formation, it depends on how much is the plaque or how much is the circulation blocked. But when this becomes symptomatic, the symptoms may be chest pain, which is also called angina. There may be palpitations, there may be increased heart rate, you may feel very tired, and then also there are other things like there may be cough or hemolysis, which is like when you spit out there will be blood in the saliva. So these are some of the symptoms, but also the bad ones or life-threatening ones, which is like heart attack, could be one of the things which is led by coronary artery disease. Now, when we talk about the management, there is two kinds of management: medical management and surgical management. Surgical management में different kind of procedures आ जाते हैं for this condition, जैसे कि coronary angioplasty. Coronary angioplasty or PTCA, as you can see in the picture, in this process we compress the clot or the plaque against the walls of the artery. लेजर एंजियोप्लास्टी भी होती है. उसके बाद CABG, this is invasive process procedure which is done in severe cases. स्टेंट प्लेसमेंट भी हो जाती है, कई बार स्टेंट प्लेस किया जाता है जिससे कि दोबारा उस जगह पे उस आर्टरी में प्लेक फॉर्मेशन ना हो. So these are the surgical procedures used for coronary artery disease. और मेडिकल मैनेजमेंट में हमारे 3 गोल होते हैं which we have to focus on. सबसे पहले ब्लड प्रेशर लो करना है. लो करने से मेरा मतलब है जो हाइपरटेंसिव पेशेंट्स हैं उनका ब्लड प्रेशर नॉर्मल रेंज में या फिर लोअर रेंज में लेके आना है. दूसरा हमारा गोल होगा जो आर्टरी जो ब्लॉक हो गई है या पार्शियली और कंप्लीटली उस प्लेक की वजह से, तो उस ब्लड सर्कुलेशन को बेटर करने के लिए हमने आर्टरी को डायलेट करना है. और उसके बाद हमारा आखिरी पर्पस होगा कि जो कोलेस्ट्रॉल है उसको भी हमने कम करना है, जो ब्लड में कोलेस्ट्रॉल बढ़ा हुआ है. सो टू कंप्लीट और फुलफिल दीज 3 गोल्स वी यूज बीटा ब्लॉकर्स टू कंट्रोल द ब्लड प्रेशर. We use nitrates and calcium channel blockers to dilate the arteries and reduce the spasms, and we use anti-cholesterol medications to reduce the cholesterol levels in the blood. Now, as a nurse, the most important part comes now. As a nurse, what is your responsibility? So let's talk about the responsibilities of a nurse in the management of coronary artery disease. सबसे पहले we will talk to the client if there is any barriers to their therapeutic plan. Sometimes like compliance to the therapeutic plan is very important, but this is one of the barriers for the patients. So we have to talk to the client, identify the barriers to therapeutic adherence. You also have to talk to the clients and identify the barriers to regular health maintenance, things like exercise, good sleep, and give them all the suggestions and health education which is required. We have to educate the clients about the medications and the diet. So, what do you think could be the diet of a heart patient? So when we talk about the dietary control, so the diet which we recommend for coronary artery disease patients is low carbohydrate, low fat, low cholesterol, high fiber diet, and low sodium. So low sodium, low carb, low fat, and high fiber diet. So we have to educate our clients on the dietary habits, and we have to strictly tell them that this is lifelong process. They have to follow these habits over the period of their lifetime. It's not a thing for a few months. So they have to be careful for the lifetime process. You can also guide them and educate your clients for community resources. If someone wants to quit smoking, wants to work on their body weight or exercise, so we can refer them to different community resources which are available. So as a nurse, this is the responsibility which we have to fulfill. So if you're watching this video today and it has helped you to understand coronary artery disease and different factors causing this and the prevention and management, please follow, subscribe our channel, like and share the video so we could help you with more videos like this. Also, you can comment about if there is any topic you would like us to talk about. Thank you.